want to welcome you to this webinar on equine gastric ulcer syndrome, which is near and dear to my heart because I struggled with it for my horse all of last year. So I think it's good information for every horse owner to have and be on the lookout for. And our presenter tonight is Dr. Emily Rule, and she's from New Bolton Field Services. And we appreciate that she's giving her time and information to us tonight. She's graduated from the University of Penn School of Veterinary Medicine, and after completing a one-year rotating internship at Blue Ridge Equine Clinic in Virginia, she returned to the University of Penn, where she completed a 2-year ABVP residency in Equine Practice with New Bolton Center's field service. And then following the completion of her residency, she remained at New Bolton Center as an assistant professor of equine field service. And Emily enjoys all aspects of general equine practice, including sports medicine and diagnostic imaging, dentistry, reproduction, and preventative care. So thank you again very much, Dr. Rule, and I'll turn the meeting over to you.
Great, thank you. Thanks so much, Debbie. Thank you so much, those of you that are here, and then hopefully some people might be able to enjoy this later as well. So I'm just going to start off with a little bit of anatomy of the stomach. So the equine stomach is basically divided into 2 separate parts, and they are covered by different types of mucosa. So we have the upper part of the stomach up here, and then the lower part down here. And so the lining in the upper part of the stomach is that kind of nice light pink color, and we refer to that as the squamous or the non-glandular mucosa. And then the lower part is a darker pink area, and that's referred to as the glandular portion. And so the glandular portion, the lower part, is where the gastric acid is produced, and that's what helps horses and people digest their different foods. And then mucus and bicarbonate are also produced there, and they are ingredients that help to buffer the stomach and sort of protect the stomach lining from that acid. So naturally down in this lower area, we sort of have some natural acid protection, but the upper portion does not have those buffers. And so it relies on constantly having food in the stomach and saliva from swallowing food. And that's what helps protect it from the stomach acid. But when acid does come into contact with the squamous mucosa, this can result in some irritation or ulcer formation. And the area that's most common to happen is sort of right in this lower part, because you can picture there's acid sort of down here and it splashes up in this lower area here, and we can get ulcer development along that line. The ulcer formation in the lower part of the stomach can also happen, and that is a little bit more complicated and probably multifactorial, but the most common place for ulcers to form in this lower glandular portion is right here at the pylorus. And the pylorus is the opening into the duodenum, which is the first part of the small intestine where the food will go on to be digested. And then I just have kind of tried to create a little bit more of a 3D picture here. So these are some different images from gastroscopies that I sort of pieced together here. So you can see there's this nice light pink squamous part up here, and then this darker glandular part right here, and the line between them we refer to as the margo plicatus. And then there's a little bit of food and kind of liquid ingesta down here. Up here, you can see this is our gastroscope coming in, and we've sort of curled around and we're looking back at ourselves. And you can see some nice saliva coming down, and that's what helps protect this lining. And then we'll look at this a little bit later, but this sort of shadowy area down here is going to go off into our pyloric region. So that's where we're going to be able to look for those ulcers. So because the 2 areas of the stomach are, have different lining and have different disease processes, we treat them differently in the medications that we use. And so some specialists have sort of developed some terminology to refer to the different conditions in the stomach. So we use EGUS, or equine gastric ulcer syndrome, and that's a general term for any erosive or ulcerative diseases of the stomach kind of in any location. And then we further break that down based on the anatomic location for both the squamous and glandular disease. So we have ESGD and EGGD, just to make things nice and complicated for us. So clinical signs of gastric ulcer disease can be extremely variable and sometimes really nonspecific. So these can be really, really subtle changes in the horse that may prompt you or the veterinarian to sort of take a closer look, but they're not always these extreme changes in the horse. So sometimes we can see anorexia or just decreased appetite. So he used to finish, his whole grain bucket, and now he's been leaving a little bit left over. Colic is definitely common, and oftentimes this is not severe colic, so the horse may not be laying down and thrashing, but they might just seem a little bit uncomfortable, especially after their meal. So they might come in, eat their grain, and then a few minutes later, they just seem not quite right. They might be pawing a little bit, stretching out, or looking at their side a little bit, or curling their lip, or they might just seem kind of a little bit depressed from what they normally would look like. Poor performance is definitely a common sign that sort of leads us into doing a gastroscopy. So this could be in really any equine sport that, he used to be at this level and now he's at this level. And so it can just be sort of a subtle change where he or she's just not performing quite like they used to. Poor hair coat is also a sign. So they just seem kind of dull. Their coat doesn't look very shiny and nice. And that is another thing that just might prompt us a little bit. Decreased conditioning or weight loss, or a horse that just sort of is not, failure to thrive or not really thriving. So it might be a new horse that comes into a situation and just, you're not able to get weight on, and they're just not picking up like a normal horse should. Change in attitude is definitely a big one. So, my horse used to be nice and now he's kind of a jerk, or he's pinning his ears and he didn't used to do that. He's really sensitive when I'm brushing him or putting the saddle on, putting the girth on. He doesn't like, when I pet him, and he used to. So these sort of changes in attitude can definitely be a sign. Diarrhea is a little bit confusing. It's definitely been linked to gastric ulcers in certain textbooks and papers and that sort of thing. And it may be sort of an indirect cause, but sometimes these horses do have diarrhea or sort of chronic loose manure. And that may be a sign that they have some gastric disease. And then teeth grinding is another one that's typically more common in younger horses or foals, but that can definitely happen in older horses as well. So, all of these can be definitely a wide range of severity, where it could just be kind of a subtle change, or sometimes horses are really quite uncomfortable and they have a huge attitude change or significant colic episode. So risk factors, there are lots of different risk factors that can lead to ulcers. Under normal conditions, horses are supposed to be constantly grazing, right, out in a field, and that way feed and ingesta in their stomach are constantly sort of helping to buffer the stomach and keep that upper portion from being damaged by acid. So when we keep horses in stalls and hold them off feed for really any period of time, this natural buffer can be impacted and is no longer protecting the lining. And so that can leave it sort of susceptible to ulceration. High starch grains, especially sweet feeds, can increase volatile fatty acid production, and that can lead to an increased ulcer risk as well. And those foods are really easily digested or rapidly digested in the stomach. And so they require less chewing time and less digestion time. And so there's less buffering activity going on in the stomach because it's just sort of moving right through. And we're not getting as much saliva production. So that can definitely contribute to ulcers as well. Stress is a big one, and everybody kind of knows about stress leading to ulcers. This can be lots of different things. So environmental stress, social stress, traveling, illness. So horses in the hospital definitely can be impacted. Changes in a routine or environment, different turnout paddock, turnout time, things like that can all definitely impact them. And what happens is they, when they have increased levels of stress, they release more cortisol hormone, and the cortisol can result in decreased production of prostaglandins. And there are good prostaglandins and bad prostaglandins. So we talk about prostaglandins with things like pain and inflammation and that sort of thing. But prostaglandins are also really important for protecting the lining of the stomach or the mucosa. So that cortisol can sort of lead to mucosal damage because we have decreased prostaglandins. Interestingly, there was one study that showed that there was increased ulcer risk when the radio was constantly playing, which is really common in a lot of horse barns. And actually talk radio was more likely to induce ulcers than music. So some of that, listening to the news all day can be stressful for horses too. So if you're going to play the radio, it might be good to put on a music station instead of talk radio. And then non-steroidal anti-inflammatories like bute and banamine can lead to ulcers as well. So these medications also decrease prostaglandin because they are trying to impact that inflammation side, but they also decrease the good prostaglandins. And so that can reduce the mucosal protection and decrease mucus production and decrease mucosal blood flow, which are all really important things to protect the stomach. And so those can lead to ulcers. EGUS is a medication that is designed to have less of a negative impact on the GI system. So for horses that need to be on long-term NSAIDs, you may have heard of people recommending EGUS instead of bute or banamine, but they still can have those negative effects when they're used long-term. Lack of continuous access to water is also associated with increased ulcer risk. And actually electrolyte pastes have been associated with increased ulcer risk. So that's when the paste is going directly into the horse's mouth, not a powder mixed in with food or water. Those are considered safe. Training and exercise and showing all increase ulcer risk. And this is probably for a lot of different reasons. So the horses are often going longer periods without food. They're in a new environment. There's increased stress with kind of being in this different place, traveling, trailering. There's also the potential in high, intensive exercise or strenuous exercise that you can have decreased blood flow to the stomach, which can impact ulcer formation as well. So these are just some statistics from competition horses from some kind of various studies. So actually up to 100% of horses who are actively racing had ulcers when they were scoped. 93% of endurance horses had ulcers during the competition season, but then only 48% had them in the off season. So definitely some impact of competition. And then non-racing performance horses, so show horses, had only 17% had ulcers prior to competition. And then when they scoped them again after competition, 56% of them had them. So definitely seems to be an impact for these horses. Again, these are just kind of some different numbers from a few different studies. So the racing numbers there, 70 to 90% or 95%, those were sort of not necessarily all actively racing, but in general race horses. Show horses that are active, 58%, 40% of Western performance horses, Only 11% of horses in a riding program at a university, and then definitely horses that are in a hospital or referred for colic, definitely high prevalence there. And that is for the squamous ulcers, and then glandular ulcers a little bit lower on this glandular horse side, but still, 40–50% of a lot of different populations. So a really high prevalence in horses that are doing some sort of job. So in terms of diagnostics, gastroscopy is really the only accurate diagnostic to diagnose gastric ulcers. So in terms of procedure, fasting beforehand is absolutely imperative to getting a complete picture of the stomach. So fasting from all food is required for a minimum of 12 hours. Some veterinarians recommend more than 12 hours, but that's definitely the minimum. And sometimes we recommend leaving the horse in a stripped stall or putting a muzzle on, because they will, when there's nothing else, they'll turn to eating their own bedding ahead of time. And then water may or may not be withheld, again, kind of depending on the veterinarian, but no more than a few hours without water. So we would keep it overnight and then pull it in the morning. Typically, we would do kind of a brief exam and then sedate with a IV sedation. And then this is the unit that we have, the field unit that we have at New Bolton Center. So typically a 3 to 3.5 meter long endoscope is used. So really long when you see it all extended out of the box. And we're going to pass that through the nostril of the horse into the throat, and then wait for the horse to swallow and advance it through the esophagus down into the stomach. And then typically we have to distend the stomach with air and kind of blow it up like a balloon a little bit in order to see everything that we need to see. Sometimes we have to use water to clean off the lining of the stomach to make sure that we can see everything. And then it can take some maneuvering to sort of visualize all the different areas that we have to see. So I'll show a little visual on the next slide, but sometimes it can take a couple of attempts to get down into that pylorus region that we need to see in order to diagnose those glandular ulcers. Risks are pretty low with this procedure. Sometimes horses can get a nosebleed or be a little bit colicky following the procedure. They might experience a little bit of discomfort when we're passing the scope through the nose and through the throat, but most horses tolerate the process pretty well. Okay, so this is kind of back to that picture of the stomach that we had from before. So if you can picture, we're going to start coming in down through the esophagus and entering the stomach here, and then we're going to kind of curl around the stomach. Let's see if I can get that. There we go, like this. So the scope is going to kind of come down around here and pass along this margo plicatus, and then we're going to kind of scoop under here and try to get a visualization of that pylorus region here. So if you picture, we're kind of looking into this little cave here and looking up. And so we have the stomach up here now, and then we're looking into that pylorus. And this is a really common area that we're going to be seeing the glandular ulcers. So it used to be kind of common to just go ahead and treat horses with GastroGuard prior to scoping if people were noticing clinical signs. And that was sort of because the cost of scoping was so much higher than the cost of medicating that people would just, or similar, that people would just medicate and not scope. But the cost of GastroGuard has actually kind of continued to go up, and gastroscopy has become a lot easier and more efficient to do in the field. And so typically it's actually going to end up saving money in the long run to start with a gastroscopy to get a good diagnosis, because we may be misdiagnosing signs. And additionally, there are sort of multiple treatment options for treating ulcers in different locations. And so we prescribe medications based on what type of ulcer we found, or types. Sometimes they have both types of ulcers. So because of this, it's definitely recommended to perform a gastroscopy to try to get an accurate diagnosis and come up with an appropriate treatment plan for the best results kind of in the long run. Apologize if you hear my cat screaming in the background, making her debut. So we use a 0 to 4 grading system to document squamous ulcer disease in horses. So I'll just show you a few different images of horses that I've scoped recently. So this is a normal squamous mucosa. So we have a nice intact epithelium or outer layer. You can see like a nice shiny sheen to the mucosa, which is nice and normal. And we have a nice light pink color here. No evidence of redness or yellowing at all. And then this horse has some hyperkeratosis or yellowing of the stomach, and the lining can get a little bit thickened as well. So this would be, you know, technically considered a grade 1, but it might not necessarily be something that we would treat if the horse's stomach looked otherwise normal. So even just holding the horse off feed overnight for the scope can cause some of this hyperkeratosis to form. So if we're just seeing that, we don't necessarily worry too much about it. And then this is just a little bit of mild hyperemia or reddening. So just kind of this little red spot here, but the actual lining appears to still be intact here. So a pretty mild lesion there. So now we're starting to get into some smaller lesions or ulcers here. So these kind of pink areas here, these more pink areas here. So starting to get into some ulcer disease in this grade 2. And then grade 3, these horses are starting to have larger lesions or extensive small lesions. So this horse had pretty small lesions, but they were pretty much covering the whole surface. So pretty severe there. And then grade 4. So these horses have pretty extensive lesions. They have some areas of deep ulceration. This one on the right, really pretty deep ulceration. You can see this top layer is pretty much gone here. And again, these horses, it's a little hard to look at these images sometimes because you just think of how painful it is. So this is some really deep ulceration here for this horse.
Can I ask a question?
Yeah, please go ahead.
What was the, I know you have your diagnosis, but what caused this? What was the environment that particular horse was in? Can you tell us?
Yeah, like this one here.
Yeah, what was his environment? What was it, a racehorse? Was a lot of stress on this horse, or?
Yeah, I wish I had a good reason for this horse. This horse has been a little bit frustrating because he has a very relaxed lifestyle. So he is a school horse that is used for very light riding lessons, maybe 2 or 3 days a week, like walk trot lessons. He's turned out 24/7, except for when he comes in to eat his grain, which is not very much that he gets. So we've been working to try to alleviate this horse's stress in any way we can. Now he was on EGUS for a pretty long period of time prior to the scope. So this was actually, he'd already been taken off at this point, but before that he was on EGUS. So I think part of this may have been from the non-steroidal anti-inflammatories, but sometimes it can be really difficult to kind of work out the stress. So we've definitely tried. He doesn't ever get left in alone. We transitioned his friends a little bit so that he's always out with the horses that he seems to get along with the best. And we try to make his lesson times, you know, as decrease stress as much as possible. So try not to use him during like the really busy times when all the kids are in the barn and that sort of thing. But overall, he did not live a very stressful, does not live a very stressful life.
I'm just trying to figure out the cause of that. Looks pretty
really, yeah,
pretty
really painful. I know.
Painful. But so what would you give him if he can't go on EGUS? What does he go on for this?
Yeah, so this horse actually, as a sort of an interesting point, is enrolled in a study. I believe we enrolled him in a study for CBD to try to give him a little bit of relief with his arthritis without having him on EGUS. So that's something that we're trying for this horse. Sometimes Tylenol can be an option, or different pain medications can be an option that are not as harsh on the stomach, but this one is definitely a tough case. Or doing a little bit more of a diagnosis to try to pinpoint exactly where the lameness is coming from to see if we can address that without having to have him on the EGUS. But that can be tough when they have arthritis in multiple joints. He's an older, like 20-year-old horse.
Yeah. Okay. Thank you.
Yeah, absolutely. Of course. Yeah. Feel free if anyone has questions along the way. I'm happy to stop.
Yeah, I'll add one now since you're at a point.
Yeah, please.
Great point. Typically, how long would it take for ulcers to start in a stressful situation? I mean, are we talking, let's say, a 5-hour trailer ride versus, a 1-hour trailer ride, or does it just, maybe it's just so variable and depending on the horse, but I mean, is there any kind of guidelines you can give for when you feel like maybe, they're under that ulcers may have formed?
Yeah, I think that's a really tough question. I would say that definitely in studies, when they try to induce ulcers, they can induce them in like 7 days. So it can be a pretty small amount of time from, when they did not have ulcers, and then they did something to induce ulcers, like holding them off feed, and they can develop ulcers in a week. So I think they can develop them pretty quickly. In terms of like a period of time of stress that would be acceptable versus not acceptable, I think that just varies so much horse to horse that it would be hard to gauge. So generally we just sort of recommend, looking at what's there and then trying to decrease the amount of stress. So I think I don't think there are any hard numbers in terms of like the length of a trailer ride. I think, even a short trailer ride for a half an hour for some horses can be really stressful. So it's not necessarily, shipping down to Florida and back. It can be just kind of these smaller trips to lessons and things, which I know can be tough because that's, how we all get to enjoy our horses. But yeah.
Okay.
I have a
Yeah,
question
please.
too. Can they heal on their own if the whatever caused them changes?
Yeah. I definitely, they definitely can heal on their own, and they probably just take longer. So I'm sure there are tons of horses that are undiagnosed out there that do end up healing on their own. And I think that it just takes a lot longer. Now, these severe ulcers, I think they kind of get into a vicious cycle where they're probably constantly redeveloping new ulcers. But if you have a horse in a really stressful situation, say a racehorse, and then you retire that racehorse and put it out in a sanctuary where it has turnout all the time, I think we probably eliminate most of those ulcers just by changing the environment. So I do think that the environmental change is as important, if not more important, than the actual medications that we put them on. For sure. Anybody else while we're sort of paused? Perfect. Okay. So then feel free again to stop me anytime. For the glandular ulcers, we, instead of like a number grading system like we have for the squamous ulcers, we sort of just use these descriptive terms, at least for now. So someone may go on to develop a number grading system at some point in the future. So these are both pictures of a normal pylorus. So we have kind of a nice, fairly, homogeneous, consistent pink color, not too mottled. Some mottling is sort of normal, but this is fairly consistent here. And so this is the opening into the duodenum, into the small intestine. So sometimes we see bile and that sort of thing coming through on the gastroscopy. And then this horse just has a really mild lesion here. So you can see it's just a little bit darker pink there. But for some horses, if the clinical signs are consistent with ulcers and they have a mild lesion like this, we may treat them to see if we can improve their behavior, because the severity of the lesions when we diagnose them on the gastroscope and the severity of the clinical signs that the horse is demonstrating really don't correlate at all. So some horses can be really painful with just 1 or 2 mild lesions, and other horses could be scoped for, a study or something that were perfectly normal, and we can find tons of ulcers in those horses. So it really does vary a lot, horse to horse. And then this is a little bit more severe here. So this is actually the same horse before and after. And this was actually the same horse, if you remember, on the grade 4 that had like a lot of stripes around here of red stripes. So this horse had two different types of ulcers, and this was at the first scope and this was at the second scope. So this was a dressage horse that was young and kind of anxious naturally, and had been recently moved from one barn to another barn. So there were kind of a lot of new factors in this horse's life. So I think this horse probably will do well now that we've identified this and she's not in the environment that she was. But this was at the 4-week scope. So we definitely have some healing here. But this horse would probably benefit from a little bit longer treatment period to try to get rid of that ulcer there. But significant healing in just the 4-week time frame. And then this is a little bit more of a chronic example. So to me, this lesion looks like it's been here for a while, and the horse may already sort of be trying to heal it. So sometimes we see lesions, you can almost picture this like a scab of a wound, an external wound where we have this, kind of dried kind of blood type appearance and this kind of scabby appearance. And it seems like this horse is trying to heal this ulcer on their own. So this one's probably been there for a little while versus the last horse. Those looked pretty new. And then we have some creepy crawlies. We always get some creepy crawlies. So really common for us to see botfly larvae when we're performing gastroscopies. So they definitely can freak some owners out and students when we have them with us, and myself sometimes, to see them moving around. And they can cause some mild irritation of the lining of the stomach because they do attach on pretty firmly, but they're almost always considered a benign finding, and so we don't worry too much when we see them. They respond really well to treatment with ivermectin, so if we see them, we might recommend that the horse be treated with a dewormer. So moving on to our treatments here, for squamous ulcers, not too much has changed. So omeprazole or Gastrogard definitely remains the kind of mainstay of treatment. Gastrogard is a proton pump inhibitor. So what it does is block the secretion of acid and causes a temporary decrease in the stomach acidity. And that kind of gives the mucosa a chance to heal those ulcers. So Gastrogard is the only FDA approved treatment for equine gastric ulcers in the United States. And it's a proprietary formula, so it uses a buffered paste to help protect the medication from degrading in the harsh acidic environment of the stomach. And that's how it can, go on to work. So there are many compounded and over-the-counter formulations of omeprazole available. And rightfully, many people have tried to use these preparations because they're less expensive than the Gastrogard, which can become quite costly. Unfortunately, most of these options are rapidly degraded in that acidic stomach environment, and so they're not able to go on to the small intestine where they need to be absorbed in order to work. So because of this, most studies that have looked at a lot of these preparations have shown little to no efficacy of these products when it actually comes to ulcer healing in horses, which is disappointing because it would be great if there were some other options. There are some effective preparations, including an injectable form of omeprazole, that are available in some other countries, and they might become more, I expect they'll become more widely used in the US in the future, but we're still sort of hearing more about that. So for now, mostly Gastrogard for those squamous ulcers. A lot of times the company has rebates available. So sometimes there are online or mail-in rebates available that helps a little bit with the cost. So it's definitely something to ask about if you need to have a horse on it. And then there are H2 receptor antagonists such as ranitidine that also work by decreasing acid production in the stomach, but they've been shown to be less effective compared with omeprazole, and so they're really no longer widely used for ulcer treatment. In terms of dosing, the usual dose would be 1 full tube daily for an average size horse, but there was a recent study that was kind of interesting that was performed in Australia, and they have a different enteric coated form of omeprazole. So the enteric coating helps it from being broken down in the acidity. And they used a standard dose of 4 milligram per kilogram dose, which would be the equivalent to a full tube, as well as a half a tube or half dose and a quarter dose. And when they were given, they gave it prior to exercise and after a brief fast. So the horses were held off feed, and both of the lower doses were considered non-inferior. So that's a term they use in scientific literature a lot, non-inferior, which means that they were not worse than the standard dose for treatment of squamous ulcers. So the full dose is still the FDA approved dose and generally recommended dose for GastriGuard, but some clinicians have definitely started to use some lower doses for treatment of ulcers, just to try to, again, kind of conserve costs a little bit, and have been seeing some good results with that. So something to ask about, for sure, if you have an ulcer diagnosis. And then for our glandular ulcers, some different options are available, and recommendations sometimes vary between different veterinarians. So when used alone, GastriGuard only has about 25% efficacy in treating glandular ulcers. So that's why it's so important to make that diagnosis between, is it squamous disease or glandular disease? Because if we're trying to treat glandular disease with just GastriGuard, we're probably not going to have very good success rates. And then sucralfate is a medication we use both in squamous disease and glandular disease. It is frequently used for both diseases, but it's a medication that works by physically adhering to the stomach lining and creating a physical barrier. So it works by aiding in mucus secretion. It helps make those prostaglandins that we said were good for the mucosa, and it improves mucosal blood flow. And so when you combine the omeprazole treatment with sucralfate, we get an efficacy rate of about 67%. So definitely better than just using the GastriGuard alone. And then misoprostol, a somewhat newer drug than the other medications. It's a prostaglandin E analog, so that good source of prostaglandins, and it works by inhibiting gastric acid and then improving mucosal resiliency, so sort of how it tolerates stress, proliferation, so healing, and then blood flow. And it also has some anti-inflammatory properties. And there was a study that compared misoprostol to the combination of sucralfate and omeprazole. And in that study, the misoprostol was found to be superior for treatment of glandular ulcers. So they found that they had 98% improvement. So at least improved by, from severe to moderate or moderate to mild. And then 72% had healing, complete healing of those lesions. It's important to note that misoprostol is known to cause transient diarrhea in some horses. So you might have, the horse might have soft manure for a few days, and it shouldn't be used in pregnant mares or handled by women who may be pregnant. Treatment duration can vary a lot. So typical treatment time is 4 weeks. We often recommend that, we do 4 weeks of treatment and then rescope the horse to confirm healing, but it's certainly possible for horses to need more than 4 weeks to heal. I've also definitely seen horses that, had one type of ulcer and healed that type of ulcer. And in the meantime, they developed new ulcers of the other type during the treatment period. So that can be a little bit frustrating. And, you know, sometimes they require 8 or even 12 weeks of treatment. So that can definitely get both time consuming and expensive. But I would say the vast majority of the time when I'm rescoping horses, particularly with squamous ulcers, they tend to heal at that 4-week time frame. The GastroGuard is really quite effective within that 4 weeks for the squamous ulcers. Close attention should definitely be paid to the recommended timing of treatments as recommended by your veterinarian. So omeprazole is most effective when given on an empty stomach, and actually food in the stomach can reduce the absorption of omeprazole by up to 67%. So oftentimes we recommend, you know, if horses are in a stall, then to give it first thing in the morning before they get their feed, and then wait a little bit before giving them their grain in the morning. It also interacts with other drugs, so it shouldn't be given at the same time as other medications. And so that can get a little bit complicated when you're talking about giving multiple medications and trying to feed and trying to feed hay before grain and that sort of thing. So oftentimes I'll sort of recommend that people make a little schedule like this and check off, you know, whoever's performing the treatment or giving the feed just checks off those things when they finish. So sort of like I discussed before, medications are certainly crucial for healing of the ulcer, but once the ulcer is healed, if the horse just goes back to the same environment that they were in before, they're pretty likely to develop ulcers again. So turnout should certainly be maximized as much as possible. And ideally horses should be turned out with other horses that they like and get along with. Fresh, clean water should always be available, and care should be taken to avoid or decrease stressful events as much as possible. So again, it's so hard to identify these and try to figure out what's stressful and what could be maybe be tolerated. But you know, things like making sure the horse isn't left in the barn alone. So sometimes, you know, when we talk about the horse's daily routine, we find out that, you know, this horse lives on the corner stall, and every day during turnout, they're the last horse that's brought out to the pasture, and they're the first horse that's brought in the afternoon. And so that can be really stressful for that horse. Some horses get really nervous or agitated around dogs, or they might have their paddock is right next to the road and the traffic really stresses them out. So sometimes I just recommend sort of going through like a day in your horse's life, or put yourself in their shoes and kind of think like a horse, or think like a prey animal, and think about what things might be stressful, and then try to work with, you know, yourself or your barn manager or your trainer to try to eliminate those stressful things as much as you can, even if they seem sort of small. So like that horse I was talking about before, to us, his life didn't seem particularly stressful, but maybe some things were really stressful to him. So trying to eliminate those. And then if you have to do stressful things, or things that are stressful to the horse, such as trailering or even just exercise, it's helpful to provide a buffer prior to the stressful event, also prior to, you know, riding, putting on a trailer, before the grain meal in the morning. It's helpful to provide a buffer. And so that can be done either with some alfalfa. So a lot of times I'll just recommend to feed the horse a flake of alfalfa before getting on the trail, you know, 30 minutes before getting on the trailer, or before taking them out to exercise. Or a lot of people use the Purina Outlast, which is another good stomach buffer as well. And then in terms of nutrition, you know, along with the turnout, continuous grazing is always beneficial to help provide constant feed and saliva in the stomach, and continuous access to quality forage, you know, hay as well. A lot of our horses can't have unlimited access to grain and hay because they are obese or they have some metabolic conditions. So definitely trying to find a way to allow small amounts of feed throughout the day. So whether that's a grazing muzzle, you know, out on a pasture so that they can get a little bit of grass in, you know, continuously throughout the day, or using a hay net with small holes in it, like a nibble net, or sometimes even just putting one hay net inside of another to help kind of slow them down a little bit. That way they're getting, you know, constant access to feed, but they're not eating too much all at once. And then grain, definitely better to be fed in smaller amounts. If your horse is getting a large amount of grain, it's great if you can split it up into, you know, 3 or maybe even 4 meals throughout the day. And high starch feeds should be avoided, while high fat feeds are actually potentially beneficial. So omega-3 fatty acids can be really helpful for horses with gastric ulcers. Dietary supplementation with essential fatty acids can help increase some of that prostaglandin production. It can help decrease acid output as well. And there is some information that marine derived fatty acids or long chain fatty acids, so like fish oils, are actually a bit more efficiently used than plant derived sources. So historically, a lot of fish based oils have not been very palatable to horses who are vegetarians. So this Kentucky Equine Research product here is a good source of marine oil that has been pretty palatable to horses. So that's definitely one to consider if you're looking for a fat supplement. And there was a recent study that showed that supplementation with omega-3 fatty acids was associated with both prevention and resolution of ulcers, and they considered them severe squamous ulcers. So definitely something to consider for both prevention and if you're trying to treat. Sometimes if I have a horse with bad ulcers, in addition to the medications, I'll put them on one of these fatty acid supplements. And then in terms of pharmaceutical prevention, so omeprazole, either low dose GastroGuard or UlcerGuard, which is, you know, effectively the same medication, has been recommended for a long time for prevention of gastric ulcers as well. So, you know, either giving a quarter tube of the GastroGuard once a day or using the UlcerGuard around stressful events. So, you know, if you're going to a show or a competition or, you know, traveling with your horse or doing something stressful, kind of using this medication intermittently. And there was a study that showed that it helped to prevent ulcers in 81 to 88% of horses that were on the medication. And when they had the horses off the medication, 72 to 76 of the untreated horses developed ulcers. So that was definitely, you know, some convincing information, but there's starting to be some more information that the GastroGuard might not be quite as benign as we previously had thought, and can actually has the potential to worsen the glandular disease in the lower part of the stomach. So one thought is that if you're using the medication intermittently, you're sort of making the stomach less acidic, and they sort of get used to that environment. And then when you take them off of the medication, they have this rebound hypersecretion where they're producing more acid than they were before. And the stomach acidity is actually even worse than it was before they were on the omeprazole. And so that could potentially lead to some gastric ulcers. The acidity, normal acidity in the stomach is actually important in some ways for controlling certain bacterial populations too. So bacteria can't survive in that really acidic environment. But when we constantly raise the pH of the stomach and make it less acidic, we could potentially change the sort of normal microbiome of the stomach and even the rest of the horse's intestines. So there's some newer research into the kind of GI microflora and you know, bacteria and how it's impacted by GastroGuard and omeprazole. There was also a pretty new study where they looked at administration of omeprazole in horses that were also receiving bute, because that's something that's frequently recommended to try to prevent ulcers in horses that are getting bute. And it did actually help with prevention of the glandular ulcers, but did not help to prevent against squamous ulcers. And the horses in that study actually had some increased intestinal complications when they were on the omeprazole and bute. And some of those were actually pretty severe. So the horses got pretty sick from those intestinal complications. So something to consider. It's definitely not to say that we wouldn't ever recommend, using omeprazole preventatively, because we certainly do, but that maybe we need to be a little bit more careful using it all the time, for even at those low doses.
Just wondering how you would compare for a preventative of an upcoming stressful situation, compare using sucralfate preventively as opposed to a low dose of omeprazole, and whether that would have as much of an impact on the acidic environment.
Yeah, I am historically have not used a ton of omeprazole, just because I think the misoprostol was really effective and the GastriGuard was really effective, and to me the sucralfate was sort of extra. But recently I have been sort of thinking more about it in terms of a preventative. So I actually think it is safer, at least with what we know right now in the second, it's probably safer than doing the intermittent dosing with omeprazole. So I think if you are going to use one of those medications preventatively, there's probably you're probably safer and looking at fewer side effects just using the sucralfate. I don't know as much about the effectiveness of using. I don't know if there's much information on using it, in terms of numbers preventatively and instead of treatment wise. But yeah,
Okay.
I think the sucralfate is probably pretty safe.
Good, thank you.
Yeah. And then supplements, definitely a hot topic, and there are hundreds of them out there. There's no way I could talk about all of them or know about all of them, unfortunately, because there are lots of them out there. But I'll try to highlight just a couple. Mostly I try to focus on the ones that have some sort of, published scientific research to go along with them, because that's just how, I make decisions. But that's not to say that the other ones that are out there are bad or, less good than these ones. But I'll just talk about a couple that do have some research behind them. The other nice thing about some of these is the, at least these three, the AssureGuard Gold, the Smart Pack, the Smart GI Ultra, and the Platinum GI all come with some sort of colic care coverage. So to me, that sort of means that the company really believes in their product. So something to definitely look for when you're trying to find a supplement out there on the market. That being said, there are definitely some out there that probably have no scientific evidence that, their ingredients are not supported in any way, and they're probably just an expensive thing to feed to your horse. But I think there are some benefits to some of these products. So definitely important to talk, to your veterinarian and come up with a plan as to what to add, or, if it's just a waste of money. Let's see.
A question on the Outlast.
Yeah.
So my understanding is that that's raising the pH. It's a buffer that's going to raise the pH. Is that to do that on a regular basis? Is that bad? Is that changing the environment that's supposed to be acidic, making it too high a pH to, do normal digestion?
Yeah, that's a great question. My understanding is that the effect is so temporary that it does not have long-term effects like the omeprazole does. So the omeprazole actually changes the pH for like a whole day, throughout the day. And so the Outlast is really, kind of more like taking a Tums or something like that, where it's kind of a short-term relief for them while they're experiencing something stressful or exercising or something like that. So from what I've read, I haven't seen anything that suggests that the Outlast could have those same negative effects of buffering the stomach.
Okay, good. Thank you.
It's a good question though. So these are just a couple that I'll mention because some people have been doing some research into them. The sea buckthorn berries. This researcher found that they might be useful in prevention of the glandular ulcers in horses that were in a stall and sort of intermittently held off feed. So the sea buckthorn berries are in a lot of different supplements. The Smart Pack supplements definitely has those in there. Organic acid is kind of a broad category, and B vitamins was another one that had a little bit of support behind it. And then different yeasts, certainly plenty prebiotics, probiotics in a lot of these supplements, magnesium, and then the apolectol, which admittedly I don't know much about that, but was one that kind of came up a few times in some studies. So this one, the Platinum Performance GI, does have omega-3 fatty acids in it, which is really nice that it already kind of has that in there. Has some antioxidants, pre and probiotics. So the probiotics are the actual organisms, and then the prebiotics are sort of some people think that they're maybe more beneficial than probiotics, but the prebiotics are sort of the food or nutrients for the bacteria. So it sort of sets up the bacteria for an ideal environment to thrive, the good bacteria. Glutamine, which is in a lot of these supplements, and then it does have biosponge in it, which you may have heard about or used for horses with diarrhea or soft manure. This is a pretty low dose of biosponge, so it's not like what we'd use in a course of treatment for a horse that had loose manure. And this was sort of a recent study that feeding the supplement before and during bute treatment. So they started them on the supplement before and then continued on while they were receiving pretty high doses of bute, prevented or reduced the development of gastric ulcers. So kind of interesting study. Not a lot of other studies in terms of horses that were not on bute, but I think that's helpful. So potentially, if you do have a horse that's on Equiox or bute or one of those medications, maybe this would be something to consider for that horse. And then the Smart Gut Ultra or the Smart GI Ultra, the Smart Gut is sort of the ingredients for just the stomach, and then the Smart GI has the sort of the rest of the intestine ingredients, or the hind gut, which I'll talk about a little bit later. I have a section on that. This supplement was shown, it prevented the worsening of gastric ulcer number. So the number of ulcers that the horses had 2 weeks after omeprazole treatment without altering the gastric pH. So they tested the pH and it didn't change at all throughout that time. And these horses were in a stall and intermittently held off feed as well. So the kind of helpful thing about that is that this might be something to consider if your horse has been on omeprazole and you're looking for something, saying, I want to keep them on something to not have them go right back to having ulcers after I take them off the medication. So that was sort of the purpose of this study. So something interesting to consider, maybe the Smart Gut Ultra or the Smart GI Ultra. And the Smart GI Ultra does have the colic care coverage. I don't think the Smart Gut one does, but I know at least the Smart GI one has the colic care coverage. And then the Outlast, so again, buffering solution. What they found with this one was that it might be helpful in reducing the risk of gastric ulcers during times of stress or travel. So they fed it to horses before they were trailering, and found that it was beneficial in reducing gastric ulcer formation. So I think this is one that's, also maybe something to consider for that kind of maintenance prevention type, routine treatment. And like I said, I'll just talk about the hindgut because I do get a lot of questions about hindgut ulcers, and it's sort of an something that people ask me about a lot. So the stomach of the horse is considered the foregut, and then the hindgut includes the cecum, the large colon, the small colon, and then the rectum. And horses are considered hindgut fermenters. So the colon plays a really big role in equine digestion, sort of like the cow's rumen or stomach, where that's how they ferment feed materials into things that they can actually digest. And when we're referring to the hindgut in terms of ulcers, hindgut ulcers, we're mostly referring to the large colon and the cecum, which, you know, as you can see, take up a really large portion of the horse's abdomen and intestine. They're really, really big organs. And so they're really important. So there's definitely some companies out there that have developed some tests and treatments for this condition, and it's definitely become sort of an increasingly discussed topic over the last several years. But the true incidence and sort of clinical relevance of the condition is probably a little bit overestimated. But there was a study that looked at the gastrointestinal tracts of horses during post-mortem examination. So these were just sort of a general population of horses. And 44% of the horses that were sort of considered general horses, and then 63% of the racing and performance horses had colonic ulcers, so had some evidence of ulcers within the colon. But what we don't know, and we don't have very good evidence, is for sort of correlating these cases with the clinical findings, and, you know, are they causing disease, or are they causing signs or discomfort, or, you know, those sorts of things. And the trouble is that it's really hard to diagnose these ulcers in the live horse. So these are all done on necropsies on horses that had been, you know, euthanized or passed. But truly diagnosing these in live horses is actually really difficult. So the clinical signs in terms of true colonic ulcers, you know, when we have a horse that is, you know, that is subsequently diagnosed with ulcers in the colon, these horses are often anorexic or off their feed. They're lethargic, they're colicky, and oftentimes they can have issues with recurrent colic. They often have diarrhea, a fever, they may be depressed. And then they can develop kind of like a leaky gut and lose protein. So they'll have a decreased protein, which will ultimately lead to edema or swelling of the legs and kind of the underside of their abdomen. And then we can definitely see weight loss in these horses. So colonic ulcers are actually a very specific diagnosis to make in terms of, you know, making it in the live animal. And this is generally based on the history and clinical signs of the horse, as well as abdominal ultrasound. So we can perform ultrasound and measure the colon. And, you know, if we have thickening of the colon, then sometimes we are correlating that to ulcerative disease. But it's not necessarily, you know, in terms of the population that we see, or what we consider to be a cause of the sort of vague symptoms, like performance issues and behavioral changes, as with gastric ulcers. So sometimes, you know, people say, you know, if the horse is having some performance issues or seems not quite right, and we don't diagnose gastric ulcers, oftentimes they'll ask about hindgut ulcers, but it is sort of a different diagnosis and more of a specific diagnosis. There is this test on the market. I've had a couple of people ask me about it. It's a fecal blood test that measures albumin and hemoglobin, which are blood proteins in the manure. But unfortunately, it is, you know, it's a convenient test, but it's not been scientifically validated to accurately diagnose either colonic or gastric ulcers. So in the study where they looked at the horses on postmortem exam and diagnosed the colonic ulcers, they also performed this test in those horses. And they found that 70% of the horses that had colonic ulcers had a positive test, but 47% of the horses without colonic ulcers also had a positive test. So it didn't do a great job of accurately diagnosing who did and did not have ulcers. And the test also doesn't differentiate between ulcers in different parts of the GI tract. So 64% of horses with gastric ulcers also had a positive test. And there was a different study that showed that there was no correlation between the test result, so either a positive or negative test, and the gastric ulcer score that was diagnosed on gastroscopy. So while it seems like a good test and it's nice and simple and non-invasive, it's unfortunately we're not at a place that it's super accurate in terms of diagnosing these issues. So some of the specific causes of colonic ulcers in horses, the most common would be NSAIDs. So bute is actually the most likely suspect to cause colonic ulcers, and then Banamine and EGUS. Like I said, it's a little bit easier on the GI tract, but it can certainly still cause some issues. And NSAID-induced colitis in horses is sort of the syndrome that we often refer to as right dorsal colitis, because this portion of the colon is more commonly affected or more severely affected. So the right dorsal colon is, that sort of quadrant of the colon, and we don't necessarily have a good reason why, but for some reason that area tends to get more affected. So we will often refer to it as right dorsal colitis, but we're really talking about NSAID-induced colitis. And this is a little bit scary because the damage to the mucosa is more common, certainly when we're doing a prolonged course of NSAIDs, or when we have a horse that's been accidentally overdosed with NSAIDs. That is definitely a more common scenario. But they can actually develop this colitis or colonic ulcers with even one dose of bute or Banamine. So we give these medications all the time. We use them every day, but sort of like the GastroGuard, just something to consider, to try not to overuse these medications because they can sometimes be harmful too. One thing to note is that the risk of NSAID-induced ulcers is higher when the horse is not adequately hydrated. So it's important to make sure you monitor hydration. And if the horse seems dehydrated, it may not be a good idea to give them NSAIDs, or at least try to get them hydrated before we give them these medications. And then other toxins can cause colonic ulcers. Blister beetles is one. That's the little guy in the bottom right-hand corner. Thankfully, we don't have these critters in Pennsylvania like they do in Texas and Oklahoma and places like that. So much less common to see that here, but there are certainly toxins that can cause this disease in horses. Excess grain intake can lead to sort of an acidosis or increased acidic environment in the colon and lead to ulcer development. So, similar to the gastric ulcers, important not to feed really large starch heavy meals, and important to provide lots of forage. Parasites can also cause these, especially encysted parasites that can kind of burrow into the lining of the intestine and cause disease. So always important to do your fecal parasite testing and deworming programs. And then treatment for these varies a lot based on kind of what the cause is, but some of the same medications are used for healing gastric ulcers to treat these. So we definitely use misoprostol and sucralfate along with psyllium and those omega-3 fatty acids and some dietary changes. So, something to definitely think about and good to know about this disease, particularly in terms of the non-steroidal use, but not generally a cause for sort of vague, clinical signs or performance changes like the gastric ulcers can be. All right. Excellent. So I just, if you're looking for some light reading, here's the research papers that I used to help make this presentation, and definitely let me know what other questions you have. This is my little mare who lives in Vermont. She's just retired and hangs out.
So I have an observation. This is Helen.
Yeah.
It appears as if, based on your studies, that almost all competition horses are above 50%, running as high as 90 with the racehorse group that have ulcers. Don't you find that to be an awfully high percentage? In other words, if you're on average of all competition horses seeing 50% or more, doesn't that tell you that's almost just a part of how their body responds to stress, since the human is not going to stop competing?
Right.
And so I think what's really important is to sort of figure out when it's, and the other thing that I'm observing is it's the difference between severe chronic and responding to a particular competition where they're going to show some stress and ulcer, and then their body's going to heal. And so it seems like their bodies are set up to sort of self-heal until it gets out of control and it can no longer heal itself. Maybe and so that's really what you're looking at, because if you're seeing 50% of the horses in competition with ulcers, I don't really think it's good for people to be spending an awful lot of time medicating their animals because, you know, it's not acting quite right. It's really about understanding when the horse is significantly sick because of ulcers that its body cannot overcome. Would that be a decent analysis?
Yeah. Those are all really, really good points. I totally agree. So I certainly don't recommend going around scoping normal horses or you know, horses that seemingly have nothing wrong with them, because I totally agree that we're going to find ulcers in lots and lots of horses. And it's true that we probably need, you know, we probably need to tolerate a little level of this disease as long as the horse is tolerating it. So I think the important thing, like you said, is trying to help out the ones that are really uncomfortable, and it's making them sick, or, you know, they're showing pain, or it's changing their attitude. And then the other really important thing is working on those prevention strategies and trying to decrease the incidence of these before it even forms, and try to help them out before it becomes a big problem. So yeah, I think you're totally right. If we just go around scoping horses all day, we're definitely going to find lots of ulcers.
Yeah, and I wasn't suggesting you were scoping horses, but I do find that the general public does seem, the equine world seems a bit hyper on the ulcer.
Mm-hmm.
You know, it's sort of a new thing that everybody is very concerned with, and I think some of it's all the medications and whatnot. One of the things that I have learned recently, which I never realized, and it's really basic, and you mentioned it, was the use of alfalfa as a natural buffer. And I have to say that for years I have Morgans, and, you know, alfalfa is like, no, don't feed alfalfa because, you know, you got to starve those horses. They can't handle it. And I don't feel that way anymore. I think alfalfa is a very useful natural product that you can use very strategically. And so that's what I have done in this sort of learning process. And that's to feed a little bit, you know, before you ride, before you do some things. The other thing I've learned, and I don't know if this is what you've heard, and that is that alfalfa, baled alfalfa, is texturally much better for a buffer than pelleted.
Yep.
Not that pelleted is bad, but if you can if you can use the real alfalfa, it is a better buffer. Would you agree?
Yeah, absolutely. So the other nice thing about the, stemmy flakes of alfalfa is that it helps create fiber
Chewing.
mat.
Yeah.
Well, yes, so it makes them chew more, so they produce more saliva. And then it also produces this fiber mat on top of the horse's stomach, kind of on top of that fluid. And that helps actually prevent like a physical splashing barrier from the acid. So I think probably the two recommendations that I make the most for prevention over any supplements or anything like that is to turn the horse out more, because a lot of these horses are unfortunately stuck in stalls all day, and feed them alfalfa throughout the day. So, and I think, and you made a good point about the people being afraid of alfalfa for a long time, and it's true, and it's definitely not safe for every horse, but even though it's so green and looks really rich, being a legume, it's actually lower in sugar than a lot of grass hay. And so even for metabolic horses or horses that you're worried about, sometimes it can be a safer option than some of the orchard grass and other things out there. So I think it's a good thing to have and use, a little bit. It doesn't have to be their whole diet, but a couple times throughout the day is great.
Well, thank you very much. I appreciate it. That's it for me.
Thank you personally for this. It was a wealth of information, very comprehensive, very well organized. And I'm glad we recorded it, because I'd like to have other people take advantage of what you told us all tonight.
Great.
So
Absolutely. No problem. I think I should have put my email is probably on our website, but it's just E and then my last name Rule, ERULE at vet.upenn.edu. So if anyone has any questions, always feel free to email me. I'll usually get back in a somewhat reasonable amount of time, but if you think of something later and you have questions, feel free to reach out.
that's great. The questions have been great tonight. Learned a lot.
Definitely. Yeah. Great questions and comments. Thank you.
Thank you very much. It was
Yeah.
excellent.
Absolutely.